Hey guys, Dr. Cole here with another advanced lab testing video, and today's video is going to be discussing a food sensitivity panel. So we specifically run a food sensitivity IgG test by a lab called Great Plains Laboratory. They're located in Kansas. And so now what I have for you here today is this is actually a copy of one of my patient's tests recently, and we blocked out all the private information, name and everything, so an anonymous test here. But I want to show you what type of things we can find on a food sensitivity panel. And so the first thing I want to help you understand is when we see the words IgG, like you do right here, IgG immune response is different from IgE. And so typically when we think of like an allergic response, like to a shellfish allergy or to a bee sting, and we think about like hives or swelling or like a histamine type response, runny nose, like pollen allergies, those are all classified as IgE responses. That's more of like an immediate acute reaction, a significant reaction from your body. IgG is actually a lot more important to test when it comes to our food allergies, because IgG will not be as reactive as IgE, meaning it's not going to come on suddenly, hives, runny nose, swelling of the face, and things like that. It's going to be more chronic, low-grade symptoms like brain fog or joint pain or hormone imbalances, digestive problems, heartburn, bloating, some things that will be more chronic type conditions that have been caused by the buildup of sensitivity, the immune response to these foods over time. So it's more of like a chronic exposure type response. Now, it is important to note that if we see an elevation in any one of these foods, that means that your immune system is forming antibodies against proteins found in that food. And depending how severe the elevation is, we may have to get off of that food anywhere from 3 to 6 months to over a year to sometimes forever. So this is really important because, as you'll see here, a lot of these foods on this panel would be considered health foods that I initially put a lot of my patients on. So vegetables, nuts, fruits, things like that. But we run this test for difficult cases because sometimes, invariably, even people have difficult health challenges. Sometimes even healthy foods that you and I might consider healthy are not something that they can eat. I'll use my wife's story about this test in a minute here, but if we look at this, it's organized and grouped by category of food. So we have dairy, beans and legumes, fruits. If we scroll down here, we got your grains coming up there, fish and seafood, meat and poultry, nuts and seeds, vegetables, continuing into page 2. And then some miscellaneous test markers too. Brewer's yeast, baker's yeast, candida sensitivity, sugar, coffee, things like that. So we see that there are different color charts for this scale. And we want to see every food tested, like this fruit category. We want to see everything here in the green. The green means that your body is not reacting to this food at all. There's no sensitivity to it, and that food's fine for you to be eating. If there were an elevation like for this patient you see up here in the dark orange range, this patient has a severe sensitivity to dairy, all types of dairy. And this is actually abnormal for most of the patterns that I see. Oftentimes I will see a person be very significantly elevated and reactive to cow's milk dairy, but the goat's milk usually always in the green for most people. In this person's case, you can see that it's significantly elevated for nearly every single one of the proteins tested for the dairy category here. So this patient obviously has to stay off of all dairy. Getting back to the color charts, if something's in the green, it's perfectly fine. If it's in the yellow, like you see over here, that might be a food that we take a person off of for 3 to 4 months and then retest or evaluate their symptoms. If something's up here in this middle kind of light orange category, it might be 6 to 9 months off of that food. Like we see here in the dairy, if there's a food that is this reactive to your body, if your immune system's reacting so strongly that it's up here in the dark orange category, that might be a food that we get off of for a year or longer, perhaps even forever, depending on how, if you add these foods back in, how your body responds. And so we said that there are sometimes some surprising things that we'll see here. The dairy is a common one. Gliadin, gluten, wheat, these things are ones that I'll commonly see in people's diets as well. Wheat, gluten, gliadin is a similar protein to gluten. Egg whites, egg yolks, nut allergies and things like that. Those are some of the common ones. Candida albicans. So many people have yeast or candida issues in their gut. If that's the case, you're going to have a sensitivity to candida, and in that case, instead of just getting off of gluten and wheat, we have to most of the time get off of all grain or sugar type products that could feed that. And I know this patient here is low, but oftentimes we would see that the yeast, the baker's, the brewer's yeast, alcohol, breads, and things like that are usually elevated in a lot of my patients as well. So my wife, we did this test on her a few years ago before we were getting married. She had these strange symptoms showing up. We attribute it to the stress of planning a wedding and then just everything that goes along with that. And almonds are a healthy food that I put a lot of my patients on. I have people eat a high-fat diet. Usually we cut out the processed food, sugars, but I personally, and I have a lot of my patients, eat a very high-fat diet. When we cut out grains a lot of the time, we will replace those with things like coconut flour or almond flour. So my wife and I were doing a lot of almond flour, almond butter, snacking on nuts and seeds and things like that too. And we got this test back for her, and her almond and peanut categories were through the roof, all the way elevated, just like you would see in this patient's dairy category up here. So it goes to show that what's healthy for one person, or what may be considered a health food by many people, isn't always the same for your body. And so this is a very important test to have done to just see in black and white, yes, we could take a generalized health approach, but if we want to customize it to your body and to what your immune system's reacting against, this shows us about 100 common different foods that you may experience day to day or week to week, and that can just give us a rating for if your body can tolerate those foods or not. Once we took my wife off the almonds, no almond butter, no almond flour, her migraines went away, her knee joint and knee swelling went away, and she began to feel a lot better. So that was just one of the stories that surprised me in my own life because, again, this is a health food that we have a lot of people eat. So if you are interested in having this test done, you can contact my office at 724-237-5299. We work with many patients that have chronic health issues, and we do this advanced lab testing to begin to, like you see here, uncover root causes for why you may have the symptoms that you do. So a full blood chemistry panel is important, food allergy test, depending on the case and the person I'm working with. You may watch some of my other videos on a comprehensive stool analysis. We do saliva hormone testing to look at sex hormones and adrenal gland function, thyroid tests. So this is one of many tests that we can use in our toolbox to evaluate your current level of health right now and the best course of action diet-wise to get you to meet your health goals. So once again, 724-237-5299, or you can visit us at Dr. Zach Cole, DRZACCOLE, drzachcole.com. Thanks a lot for watching and have a great day.